Welcome to this educational video on ameloblastoma. In this presentation, we will explore what ameloblastoma is, its types, symptoms, how it is diagnosed, the available treatment options, and the overall prognosis. Ameloblastoma is a rare but significant benign tumor that typically develops in the jaw, specifically arising from the cells that form enamel, which is the hard outer layer of our teeth. It's classified as an odontogenic tumor, meaning it originates from the tissues involved in tooth development. While considered benign, ameloblastoma can be quite aggressive locally and may lead to significant bone destruction if left untreated. There are several types of ameloblastoma, with the most common being the conventional type, often referred to as solid or multicystic ameloblastoma. This type consists of a mass of tumor tissues that can infiltrate the surrounding bone structures. Another variant is the unicystic ameloblastoma, which typically appears as a single cystic lesion and may be less aggressive than its solid counterpart. Additionally, there are other less common forms, including desmoplastic ameloblastoma and the peripheral ameloblastoma, which occurs in the soft tissues surrounding the jaw. When it comes to symptoms, patients with ameloblastoma may experience a range of issues, including swelling in the jaw, pain or discomfort, and loose teeth. Often, the swelling can lead to facial asymmetry. In some cases, patients may not experience any symptoms until the tumor has reached a more advanced stage. It is not unusual for ameloblastoma to be discovered incidentally during routine dental X-rays, where characteristic radiolucent lesions can be observed. Diagnosing ameloblastoma typically involves a combination of clinical evaluation, imaging studies, and a definitive biopsy. Dentists or oral surgeons will first assess symptoms and check for any abnormal findings in the mouth and jaw. Imaging techniques such as X-rays, CT scans, or MRI can provide critical details about the size and extent of the tumor. A biopsy is performed to obtain a sample of the tumor tissue, which is then analyzed by a pathologist to confirm whether ameloblastoma is present and to identify its specific type. When it comes to treatment, surgical intervention is the primary approach for ameloblastoma, as it is necessary to remove the tumor completely to minimize the risk of recurrence. Depending on the size and location of the tumor, the surgical options may vary. Some cases may require enucleation, where the tumor is removed from the jawbone, while others may necessitate more extensive procedures, including resection of a portion of the jawbone. For aggressive types of ameloblastoma, a more extensive surgical procedure may be recommended, sometimes followed by reconstructive surgery to restore the jaw's function and aesthetics. In recent years, there has been research into adjunctive therapies and targeted approaches, especially for patients with high risk or recurrent ameloblastomas. However, surgery remains the cornerstone treatment. Regular follow-up visits are crucial after treatment to monitor for any signs of recurrence, as ameloblastoma has a known tendency to come back if not completely excised. Now let's talk about the prognosis. Generally, the outlook for individuals with ameloblastoma is quite favorable following adequate surgical management. Most patients can expect a good quality of life. However, the potential for recurrence remains a concern, particularly for the solid type. Regular monitoring and follow-up care are essential to catch any recurrences early. With advances in diagnostic techniques and surgical methods, the overall prognosis for ameloblastoma has improved significantly over the years. In conclusion, ameloblastoma, though classified as a benign tumor, warrants attention due to its locally aggressive nature and potential for recurrence. Early diagnosis and appropriate surgical management are vital in ensuring the best possible outcomes for affected individuals. Thank you for joining us in exploring ameloblastoma today. We hope you found this information informative and helpful. Please subscribe for more educational content on medical topics, and feel free to leave any questions or comments below.